Hello and welcome to Module 13, Nutrition and Wound Healing. Our objectives in this module are to discuss the pathophysiology of malnutrition, also discuss the role of macronutrients in wound repair. We're going to detail the role of micronutrients in wound repair and provide guidance on common food sources to support wound healing. Malnutrition is a result of inadequate caloric intake, overconsumption of poor quality food, or deficits in absorption of certain nutrients. Up to 67% of the population is estimated to suffer from malnutrition. Risk factors for malnutrition include poor appetite, inability to feed oneself or requiring assistance to eat, impaired sense of taste or smell, or simply inadequate or excessive intake of calories, protein, fluid, or nutrients. The elderly are disproportionately burdened with risk of nutritional deficits due to medical, psychological, physiological, social, and economic difficulties associated with increased age. Malnutrition is a common risk factor contributing to impaired wound healing. Evidence has shown that biochemical and molecular effects occur when several nutrients are missing in the wound healing process. Therefore, a complementary nutritional approach might be useful to support wound repair. Proper nutrition is something that every wound care clinician should discuss with their patients. Caloric need increases during wound healing, and it is estimated that patients should consume anywhere from 30 to 35 kilocalories per kilogram a day. The following module will outline the importance of macronutrients and micronutrients in persons with open chronic wounds. First discuss macronutrients. Protein acts as an essential building block for tissue repair. Dietary protein provides amino acids that are essential in cellular metabolism. The body is in constant need of protein to support new cell growth. Sufficient protein intake is vital in patients with open wounds. Patients should be encouraged to include high-protein food sources at every meal. It has been estimated that patients with wounds should consume roughly 1.2 to 1.5 kilograms of protein per kilogram of body weight daily. Food sources high in protein include eggs, meat, dairy, legumes, nuts, soy, seeds, and tofu. Additionally, fats provide vital fuel necessary for wound healing. Dietary fats are broken down to produce ATP to provide energy to support cellular function, therefore sparing protein for wound healing. Fat intake also assists in absorption of fat-soluble nutrients such as vitamin A and omega-6 and omega-3 fatty acid. Fatty acids are needed to synthesize prostaglandins, essential for regulating bodily processes at the site of tissue damage. Without adequate quantities of essential fatty acids, prostaglandin synthesis will be negatively affected and decrease the body's ability to mount an immune response to bacteria and other antigens. Common food sources include olive oil, nuts, avocados, peanut butter, peanut oil, salmon, tuna, tofu, and eggs. Carbohydrates provide an abundant energy source necessary for cellular proliferation, fibroblast migration, and leukocyte activity. Carbohydrates stimulate insulin production needed for anabolic activities during the proliferative phase of wound healing. Carbohydrate intake should be monitored closely in persons with diabetes since increased intake can result in hyperglycemia, leading to a reduction in granulocyte function. Food sources high in carbohydrates include whole grains, pasta, brown rice, quinoa, green peas, potatoes, squash, legumes, oats, and beans. Now let's talk about micronutrients. Amino acids are a micronutrient that play a role in wound healing, particularly arginine and glutamine. Arginine is an essential amino acid normally synthesized in the kidney and the liver. The role of arginine in wound healing is diverse. Arginine is a precursor for nitric oxide, which is essential in the inflammatory process, but also used in the production of collagen. Arginine supplementation has been observed to increase collagen deposition in wounds. Glutamine decreases infectious complications and protects against inflammatory injury. Metabolically, it increases insulin sensitivity and serves as an energy source. Research has shown that neutrophils may preferentially use glutamine as an energy source over glucose. Amino acid food sources include beef, poultry, eggs, dairy, soy, and quinoa. The role of vitamins in wound healing has been evaluated extensively. Many vitamins play a role in enzymatic processes related to wound healing. Vitamin A has been shown to be beneficial in wound healing regardless of deficiency status. Functions include stimulation of epithelial growth, fibroblasts, and ground substances. Vitamin A has an anti-inflammatory effect in open wounds, increasing the number of monocytes and macrophages at the wound site and facilitates epithelial cell differentiation. Vitamin A has also shown a particular role for the management of chronic wounds in patients that are on corticosteroids for inflammatory diseases, such as rheumatoid arthritis, where supplementation counteracts the negative effects of corticosteroids on wound healing. The role of vitamin C in wound healing is due to its influence on collagen formation, immunomodulation, and antioxidant functions. Deficiencies result in impaired immune response during the inflammatory phase with increased capillary fragility and reduced collagen tensile strength with the risk of wound dehiscence. Supplementation in a deficit patient is clearly beneficial. However, evidence supporting the use of vitamin C alone in a non-deficient patient has been inconclusive. Vitamin D deficiency has shown to have increased incidence in patients with venous leg ulcers and pressure injuries. Vitamin D and its receptor signaling regulates structural integrity and transports function of the epithelial barrier, which implicates wound healing. Vitamin D screenings may prove beneficial in these patients. I'm going to briefly discuss the mini nutritional assessment tool, the MNA tool. The mini nutritional assessment tool has been established as one of the most valid nutritional screening tools. It is recommended as part of a comprehensive geriatric assessment and is an important research tool with over 400 scientific papers published. The MNA is useful for patient teaching purposes also. Performing the MNA as a screening test is strongly recommended as the basis for a nutritional evaluation in chronic wound patients. Here is a copy of the MNA, and this is also present in your protocol. Again, this is part of your initial patient assessment and evaluation. Patient education. Tips to promote wound healing in your patient. First is to create a weekly meal plan and shopping list to include both the macro and micronutrients and those enriched foods. Eating regular meals to ensure caloric intake is essential. Having the patient stay well hydrated by drinking plenty of fluids throughout the day can also assist in wound healing. They should avoid fluids that are high in sugar content. If increased needs cannot be met through dietary intake alone, oral nutritional supplements can be used to fill in nutritional gaps. Here are references for this module. This completes Module 13. To complete the test, please click the red test icon at the bottom of your screen with the clipboard and pencil on it to receive your certificate of completion for this module. Thank you.